Good morning. My name is Dr. Prashanth Arun, consultant physician and diabetologist at MV Hospital for Diabetes, Roypuram. Today, we are going to be seeing about mucormycosis, which is now known as black fungus, which is very famous now everywhere. So this is a rare fungal disease which is more commonly seen in people with low immune levels. So this most commonly is seen as rhino-orbital mucormycosis, pulmonary mucormycosis. There are even other forms of mucormycosis which I'll be sharing to you in this video. So where are they generally found? They are found in vegetables and soils, decaying particles everywhere, and they are mostly airborne. So when they are airborne, why doesn't everybody get it? The thing is, the normal human body, the immune system is good, hence it prevents us from developing this fungal disease. So as I said earlier, it is more common in people who the immune levels are less and in people with diabetes. So why people with diabetes? This rhizopus organism has an enzyme which actually grows when there is high glucose and when the body is in the diabetic ketoacidotic state. So there are some researchers which did take blood from a normal individual and they took blood from people with diabetes, and where we can see in people, the normal people, the growth of this rhizopus was not there, and the growth of this rhizopus was very fast in patients with diabetes and DKA. So what are the risk factors for this mucormycosis? All patients with mucormycosis have some underlying disease, not healthy individuals. Some underlying disease will be there, like diabetes, or they'll be on treatment for steroids, or they would have had a high load of iron supplements, or AIDS, or they'll be in some kind of malnutrition or in some trauma with some burns. So all these patients are more prone for developing mucormycosis. We are not talking about healthy individuals at all here. So now COVID-19 and mucormycosis. So generally in COVID patients, when they are on treatment, it could either come several days to several weeks post COVID treatment. More commonly in COVID patients, we see rhinocerebral mucormycosis and pulmonary mucormycosis. And in COVID also, not all the COVID patients develop mucormycosis. Largely seen are the ill patients who are severely ill and on treatment on steroids. As I said earlier, because the steroids actually bring down the immune level of the body, which actually secondary infections from this mucormycosis is more common in COVID-19. So what are the symptoms that we should note for this mucormycosis? Generally, people can have fever, nasal congestion, headache, and this nasal congestion could have even some nasal discharges which are more in brown in color. Orbital cellulitis, when I say orbital cellulitis, they can have swelling in the eye and some discharges coming from the eye, and some patients can even go blind because of this mucormycosis. So next we'll be seeing what are the types of mucormycosis. So as we already said, rhino-orbital mucormycosis, pulmonary mucormycosis. Now there is other forms also, gastrointestinal mucormycosis, and then if you see cutaneous mucormycosis which can come in the skin, then there is renal mucormycosis in the kidney, there is isolated CNS mucormycosis which could come in the brain. So diagnosing, how do you diagnose this? Definitely we cannot sit at home and diagnose this, so you'll have to go to your doctor, and then there is no need to panic saying that we have mucormycosis or stuff. You have any symptoms that I have told you earlier, you need to visit your doctor, and then he will be doing few tests to find out. He could be doing a culture, he'll be doing a histopathologic biopsy, or if it's in case of rhinocerebral or rhino-orbital, they might be doing an endoscopic biopsy to rule out mucormycosis. Even CT and MRI can find out mucormycosis. More challenging is this pulmonary infection. So pulmonary infection, it will again present same as pneumonia. So we'll have to differentiate the normal pneumonia from mucormycosis. And the treatment being just antifungals can work. Now this amphotericin B drug is in demand again, like this remdesivir, which was earlier. This is mainly because of panic buying. Even when people don't have mucormycosis, they say, let's buy 4 and keep at home, let's buy 5 and keep at home, just in case of safety. Not everyone would require if they develop COVID-19. So panic buying needs to be really stopped. The doctor decides on whether you need the antifungal or not. Next, by controlling your blood sugars, keeping your blood sugars well under control post COVID recovery and during treatment, and taking all your medicines properly, keeping your blood sugars under control. Inappropriate use of steroids. So when I say inappropriate, it does not mean that everybody needs steroids. It is that only a set of people who develop COVID-19 really need steroids when they have low saturation or when they have lung findings and all. They'll need steroids. Not all the patients need steroids. So definitely suddenly you turn out to be positive, it's not that okay, let's take steroids, my saturation will not drop. No, again, by taking steroids your body's immunity is going to go down and maybe you will be developing mucormycosis. As I said, it's more common in people with low immunity. Next, there are few surgeries also, like when you have it in the eye and all, we'll have to do some cleaning for that area. We'll have to debridement, they say debridement. So we'll be debribing that area. So even surgeries are there. So it is best that when you have symptoms, you visit your doctor so that he can choose what treatment is appropriate for you. So now to conclude, I will answer a few questions that is very frequently being asked to me by my patients. When do we check blood sugars? How much do we keep our blood sugars post COVID infection? When do we need to go meet the doctor? Because most of them find it really difficult to travel to their doctors these times. But let me tell you, most of the doctors are available online now with online consultation. You just need to do simple blood tests like HbA1c, which is a 3 months average blood sugar, which will tell you how your blood sugars are. Next, fasting postprandial. You can even check your sugar at home with a device called glucometer, where you can simply check your sugar and know whether your fasting is less than 120 and your postprandial, that is after food, is less than 180. So these simple things can actually save you. And next, few patients may require insulin either during the treatment for COVID-19 or for some time post the treatment also, till the sugars come down. So there is nothing wrong in taking insulin. Most of them say, sir, once I start insulin, then I'll have to continue it lifelong. There is nothing. Once the sugars start coming down, we can slowly again titrate the insulin dose and shift you back onto tablets, which is really good. As I told you earlier, that this infection grows more when the sugar is very high. Next, steroids. Most of them ask me, sir, can I just buy some steroids, keep at home when I have positive? If I take steroids earlier, will my lung improve? Unless and until the doctor prescribes, you don't have to take steroids, because the doctor will see for symptoms, lung involvement, and there are so many things to look in before you start steroids. So it is definitely not good to start steroids by yourself at home. Next, fear of surgery. Many people, when we say that there is this infection and you'll have to be operated, you'll have to do debridement, they say, I am very scared on doing surgeries. So there is nothing to be worried about. It is a small surgery that cleaning happens and the debrided tissues are removed and all that. And then you can send it for culture, biopsies to evaluate the disease. So there is nothing wrong in the surgery for doing for this. Next is antifungal. As I said earlier, there is no need for panic buying, no need to buy antifungals and store at home. If needed, it will be available and it will be given to you. And definitely not all COVID patients need to take antifungals as a preventive measure, because not everybody is going to develop mucormycosis. Only when developed it is necessary. Otherwise, it is definitely not necessary. I hope this video was very useful for you. We will be putting more videos like this with medical related content. What videos you want next, you can put down in my comment sections. I'll try preparing videos and giving you for that. Thank you.